Dancers have one of the highest injury rates of all athletes. At Ohio University, Dr. Jeff Russell, Assistant Professor of Athletic Training, is taking action to ensure the health of dancers and all performing artists. While at OU, Dr. Russell has worked with the School of Dance to convert the former student lounge into a clinic.
And we're working in performing arts medicine both to take care of dancers that are injured, but also trying to get them back to their dancing without having another injury. And then the best solution is to try to prevent injuries. And so we're also starting to work with dancers on physical conditioning that's going to help them be able to reduce the chance of injury because they're better physically trained for the really sophisticated kinds of physical activity that they're involved in. So, well, we're here in our Performing Arts Medicine clinic, and this is a dancer, Allie, and she's agreed to let us film her as we're looking at her injury. And she had an injury that's actually one of the most common injuries in the entire world, and that is a lateral or outside of the ankle sprain. And so she actually is looking quite a bit better today than she was last week because her coloration of her bruising is all gone. So in Allie's particular case, the way this injury occurs is when the foot and ankle turn in this way. So there's an injury to the ligaments that are here on the outside of the ankle, and possibly you can see in the video that there's a bit more swelling here, and if I compare it to the other side, then it's quite easy to see that she's still got a little bit of that swelling. And so we're going to try to work on her today and have some exercises for her to start building back a bit of the body's defenses to try to stabilize her ankle a bit, try to work on the muscles and the nerves that control all of the area of her ankle and legs so that she's able to go back to dance and she doesn't have pain. She's able to move her ankle in its normal pattern, and so that she's able to do this with hopefully a lower chance of having a re-injury. So what I'm doing is I'm just watching her ankle and her foot and the way that she goes up and down. I'm asking her about pain. I'm looking at the motion, the way her ankle and foot moves, because all of this is important. If we're going to have her go back to the things that she's typically going to be doing in dance, then clearly we have to make sure that we understand where she's at now so that we know what she is and how she's progressing as she goes forward. But this is just an example of how we have a specialized facility that's designed to take care of dancers and other performers, because performing artists are very much athletes. And so we take care of them in much the same way that we take care of athletes that play football or basketball or baseball or volleyball or typical sports like that. And so the incidence of injury in something like dance is actually quite high, and so we want to make sure that we have health care for dancers. And again, I mentioned other performing artists, so people that are in theater, people that play instruments, people that sing even. There are a lot of healthcare needs there. So we're really trying to be a pioneer in this area at Ohio University and provide this kind of support for our students that are performers. That's a little bit about our Performing Arts Medicine program, and just would welcome anyone that is interested in it to contact me, and we'll tell you a bit more about the program.